Hello, everyone. It's my pleasure to welcome you to this event where we're going to discuss humanitarian financing in the current global environment. My name is Lisa Carty, and I'm the Director of Humanitarian Financing and Resource Mobilization at the UN's Office for the Coordination of Humanitarian Affairs. During this session, we're going to take a closer look at some of the trends, as well as the opportunities, the challenges, and the lessons learned from the COVID-19 response. OCHA has a long-standing relationship with development initiatives, and we're very pleased to be co-hosting this event together. We'll begin today with DI's comprehensive annual Global Humanitarian Assistance Report that brings together data, analysis, and emerging trends in significant ways. I'll then present an update of the Global Humanitarian Overview, or the GHO. Together, these presentations will be a very solid starting point for what I'm sure is going to be a most interesting conversation with our distinguished panelists. So now I'd like to go ahead and introduce our panel members. First, we have Angus Urquhart, who is the Crises and Humanitarian Lead at Development Initiatives, and he will launch this year's Global Humanitarian Assistance Report. Second, we're very pleased to be joined by Matt Kimmel, Director for Humanitarian Policy and Global Affairs at Global Affairs Canada, who will share experiences from the donor perspective. Next, Cecilia Rosselli, the Director of the Norwegian Refugee Council Geneva office, who will reflect on some of the key challenges faced by humanitarian partners due to the current funding environment. And after that, Dr. Asha Mohammed, Secretary General of the Kenya Red Cross Society, will share some of her organization's experiences from the COVID-19 pandemic and how it has influenced their priorities and their resource mobilization. To wrap up the panel, we'll be hearing from Tasfia Salek from the START Fund, who's going to tell us about pooled funding and START's approach to support local networks and actors. Before we proceed, let me just share a couple of housekeeping points, please. First, just so everyone knows, the event's being recorded and it will be available on the same website on which you have registered for today. Second, just to please remind my fellow speakers, please remain muted until you're invited to speak, and then you will need to unmute yourselves. Third, we really do look forward to your questions and having as interactive a session as possible. So please do use the Q&A box at the bottom of your screen to ask questions, and include your name and organization before actually submitting the question. Please try to indicate if your question is for a specific panelist or if you'd be happy for anyone to answer it. And to share any general comments or feedback, please just go ahead and use that separate chat box also on the bottom of your screen. So I think with that, we will go ahead and get started. Thank you all for joining us. And now I'm gonna hand over to Angus from Development Initiatives. Angus, please, the floor is yours.
Brilliant. Many thanks, Lisa. And on behalf of DI, welcome to all of you who've joined us online. And a special thank you also to our panelists for sparing the time and their expertise that they're going to share with us in today's discussion. As Lisa mentioned, my task today is really to kind of set the scene, I think, for the further discussion that we have amongst our panelists. I'm going to share some of the key findings from Development Initiative's 2021 Global Humanitarian Assistance Report that we've published today and that you can now access online on our website. In the 20 years or more indeed that DI have been researching and analysing how humanitarian response is being financed through our GHA reports and other outputs, we've always tried to take, I think, both the wide and the long view across the system and over time. And taking that perspective, what I'm going to try and briefly cover today for the next 10-15 minutes is the following things. So how much international humanitarian assistance do we have in the system? Who's providing this? How is it being provided? And also how are efforts to improve and transform humanitarian and wider crisis financing progressing? So how much international humanitarian assistance was there in 2020? And what we're showing here is the total amount of humanitarian assistance in the system. So this includes all public funding, both inside and outside of UN appeals, whether that's to countries with UN appeals or others which don't have those. And also how much private assistance has been provided for humanitarian response. So what we've seen is steady year-on-year increases for a number of years, and overall a significant growth in international humanitarian assistance. So between 2012 and 2018, international humanitarian assistance has almost doubled. Yet, as you can see, there was a stalling of that growth in 2019. In 2020, despite the unprecedented level of need, international humanitarian assistance flatlined, remaining at roughly similar levels to 2019. Here we have, based on preliminary data for 2020, a total of $30.9 billion being committed. As you can also see in the top section of the graph, you can see that private assistance remained at roughly similar levels to 2019 as well. So with estimates for 2020 of around about $6.7 billion. And with the majority of this assistance being provided by individuals.
Do you have something to tweet?
So what's behind these overall aggregate figures for international humanitarian assistance? So notably, we saw that many donors gave more humanitarian assistance in 2020. Of the 20 largest donors, who give nearly all of humanitarian assistance, so about 96% last year, 13 increased the volume of assistance that they provided. And as you can see in the aggregate increases for both Europe and North America, the top two lines on our chart. Among these donors, the two biggest donors, the US and Germany, both increased the amount that they provided. So the US's assistance increased by 6%, while Germany provided 27% more funding in 2020 than 2019. Yet, as we can see with the flatlining of total humanitarian assistance, these increases were counterbalanced by large falls from a small number of donors. So, for instance, the volume of assistance provided by Saudi Arabia reduced significantly by close to $700 million. And most notably, and perhaps most well publicized, has been the drop in assistance provided by the UK. So in the UK, assistance provided reduced by about a third, falling by almost $900 million from 2019. I think in part, what we see with the UK's reduction in funding is partly the fragility of a system that's dependent on a small number of donors and that's dependent on an even smaller number for a very large proportion of its assistance. So how does this picture of international humanitarian assistance relate to humanitarian need? We know that in 2020, COVID-19 drew more people into crisis, and also compounded the challenges for those who are already experiencing humanitarian crisis. We know that the number of countries experiencing protracted crisis continue to grow. So we've used a rough proxy here of countries with 5 or more years of consecutive UN coordinated appeals. And when we look at using that proxy, we see that the number of countries in this situation of protracted crisis grew to 34 in 2020. That's almost double the number from just 6 years ago. As Lisa will highlight in her presentation, underfunding has also worsened. So in 2020, we know that UN appeals were just 52% funded in total. This proportion represents a quite startling shortfall of $18.8 billion. So what do we see when we look at recipients? We see that the total amount of assistance reaching recipients, so that's both inside and outside of appeals, we can see that the largest received less overall in 2020 than in 2019, meaning that there was a large fall in the amount of assistance for emerging and pre-existing needs not associated with COVID-19. In total, the 10 largest recipients received 11% less funding in 2020. And indeed, the majority of countries received less funding for non-COVID related needs in 2020 than in 2019. So for example, among these 10 largest recipients, this meant that they received $3 billion less for non-COVID-19 related needs. As the chart also indicates, these aggregate figures mask significant variation between countries. So you can see, for instance, there was a very sharp fall in the amount of assistance provided to Yemen. So a fall of 46%, almost $1.9 billion. While conversely, we see increases in funding for Lebanon and Sudan. So we know humanitarian funding was needed for more people and in more countries in 2020. We know that COVID-19 has added to existing need. And we've also seen that financing has had to be spread more widely. And without sufficient increases in contributions, that financing has also had to be spread more thinly. As I noted earlier, more countries are now experiencing protracted, enduring crisis, so unable to sufficiently recover from previous shocks or to build resilience against future ones. The wider picture here, I think, is very important. As we've highlighted in previous reports, those living in poverty are disproportionately impacted by crisis, with crisis slowing or even reversing poverty reduction. COVID-19 has compounded this situation. As we show in this year's report, those living in extreme poverty are increasingly concentrated in countries facing intersecting risks. So in 2010, 40% of the world's poorest people, those living in extreme poverty, lived in fragile countries. By 2020, however, this share had risen to 66%. And as you can see, this increased concentration has been driven by an unequal progress in poverty reduction. We also know that multiple risks are intersecting. So 95% of people, so 466 of 489 million people who are experiencing extreme poverty and living in fragile countries are also living in countries that are identified as being at high or very high risk from the impacts of COVID-19. So if the underlying vulnerabilities to crisis are to be addressed, if we're really going to cut the number of people in need and the length of time for which they need humanitarian assistance, reducing poverty, building resilience are fundamentally important. This is obviously not primarily the role of humanitarians. It requires development and peace-building interventions in those places experiencing or vulnerable to crisis. And this points to wider changes in the aid system and the need to ensure that all aid focuses on those most in need and those furthest behind. So in this regard, multilateral development banks, MDBs, have a really important role to play. As you can see, MDBs are providing an increasing volume of assistance, increasing volume of finance to countries that are experiencing crisis. So, as you can see in the graph, in 2014, ODA, so official development assistance disbursements, so wider development funding, to the annual 20 largest humanitarian recipients have almost doubled. So from 5.4 billion in 2014 up to 10.7 billion in 2019. And it's notable that this is much faster growth than ODA disbursements to other countries. Encouragingly, MDBs are also directly addressing crisis, so through a range of different tools and instruments that are focused on building resilience, responding to shocks, and recovering from the impact of crises. And I think in this regard, there are a few interesting observations to make. The first, as you can see from the chart, is that ODA provided by multilateral development banks is increasingly provided as loans. So between 2010 and 2014, grants made up on average 35% of ODA disbursements. But between 2015 and 2019, this proportion has reduced to just 14%. So I think what's important here is that such lending needs to be carefully targeted, particularly given what we know about the growing risk of debt distress in some countries. I think the second point to flag is that this type of assistance needs to be provided in a timely manner if we're going to have proper coherence between development and humanitarian funding. And as in work we published last week with the Centre for Disaster Protection shows, MDBs like the World Bank are providing large volumes of assistance for wider crisis response. But it's not always provided in a timely manner. As an analysis we've done has shown, just a quarter of World Bank financing to 6 crises in recent years was dispersed within 18 months of the crisis starting. And thirdly, there is now rightly an increased focus on enhancing the understanding between development, humanitarian and peace-building actors of the ways of working of each. Understanding how different forms of finance is structured and delivered is a key part of this. So in this regard, better data on development finance to crisis context is key. So that's data that's timely, that's comprehensive, and that's disaggregated at a subnational level. So wider reform of financing to crises is really important. Equally, humanitarian assistance needs to be delivered as effectively and efficiently as possible. I think we've seen some progress being made, but not enough. So what do we see? How is funding being passed through the system? Here we're looking at funding provided by government donors. And the majority of funding, from government donors goes to multilateral agencies. If we were to look at the picture for private donors, the majority would be going towards NGOs. I think what's worth noting here is that this graph shows a very static picture. This is for 2020, yet we would show a very similar graph for 2018 or 2016 or 2015. We haven't really seen any shifts in practice in terms of the targeting of financing and the way it's being channeled within the system. We've seen some progress being made recently, putting in place the foundations for more transparency of humanitarian financing. So publishing open data to an open data standard, IATI, has improved significantly, and further progress is being made on enabling the use and access of this open data. However, and the point here is that more needs to be done. What we can't see from this graph is where the funding is subsequently being channeled, how it's moving through the transaction chain. We still don't know what happens to funding beyond the first recipient. Critically, this is the case for funding to local and national actors. We know that more funding is passed indirectly than directly, but we can't see how much. What we can see, and what we're showing in the graph here, is where funding is passed directly to local and national actors, is that a slightly higher proportion of total funding is being provided. So 3.1% in 2020. But if you look at the graph, this is only slightly more than the 2.8% in 2016, and it doesn't suggest a step change in the way funding is being provided for localization. Again, for multi-year funding, a key component of quality funding, public reporting is not good enough to provide insight on how much multi-year funding there is in the system, nor how this is being passed on. We've collected data directly from donors for a second time this year, having done an initial data collection in 2019. This indicates that donors are reporting that more multi-year funding is being provided. So as you can see, there's been growth from 27% of funding provided in 2016 through to 42% in 2020, having peaked at 50% in 2019. However, as we've uncovered when collecting data previously from UN agencies and INGOs, and as continues to be reported anecdotally, there appears to be a mismatch. Agencies report receiving less multi-year funding than donors report providing. We need greater transparency to be able to unpick this question. The Grand Bargain also contains the commitment to provide 30% of funding unearmarked to enable flexible responses. What we've seen over the past 5 years has, until 2020, been a worrying trend of a decreasing proportion of funding provided as unearmarked. So we've collected data here from 9 UN agencies, and this shows that the proportion of funding they received unearmarked fell from 19% in 2016 to 14% in 2019. In 2020, that proportion did grow to 17%, but that's still below the levels in 2016 when the Grand Bargain commitments were agreed. Finally, and I think more encouragingly, the steady and sustained growth in cash and voucher assistance continued in 2020. So cash and voucher assistance grew to $6.3 billion, a 13% increase from 2019. And that shows that cash and voucher assistance has almost tripled since 2015. In conclusion, I think change is certainly evident in how the system is providing financing to people experiencing crisis, both within humanitarian assistance and also more widely through the increasing engagement of development actors. Yet the speed, scale, and depth of change has not been sufficient. I'm sure our panelists will have much to say on the current context that I've outlined and on how we can make progress against some of these key commitments and key areas for reform. As I mentioned at the very start of my presentation, the GHA report is now available. You can download it online. We're conscious that in producing the report that this provides a retrospective analysis of the most recent year of data, but also that there is a need to be able to see what's happening in more real time and what the evolving situation is. And so we'll be providing a brief snapshot of analysis of financing for the first half of 2021 that we published in the next 2 weeks. So with that, I thank you very much for your attention, and I will pass back to Lisa.
Great, Angus, thank you so much really for that excellent overview. You know, when I look at a presentation as comprehensive as that was, I think, what are the couple of facts that really sort of leapt off the page at me? And I think your slide that talked about that really rapid and dramatic increase of people in poverty living in fragile contexts, that increase from, I think it was 40% to 66%. I think that's a fact that will certainly stay with me, okay? I think that's an interesting fact for us to reflect on as we go through the rest of the presentation and get to hear from our panelists, because it does really fundamentally change the context we're working in and how we need to think about our actions. So Angus, thank you for getting us off to such a really strong start. Colleagues, now you get to hear a little bit from me. I'm going to give you an update on the 2021 Global Humanitarian Overview. I have about 10 slides that we'll go through. So as some of you may recall, you may have been a part of, the Global Humanitarian Overview, or GHO, was launched last December 1st. At OCHA, we consider it among the most comprehensive and evidence-based overviews of interagency needs and responses that's available to our community. When Mark Lowcock launched the document last December, he has just recently left us at OCHA, so now our former Undersecretary General and Emergency Relief Coordinator. But when he launched the document, he made what I thought was a really compelling observation. He said that 2021 could be the year of the grand reversal, the unraveling of 40 years of progress, or it could be the year where we work together and build forward better. So as we all know, COVID-19 has brought us to really a critical juncture, and the choices we're making today really matter to how we're going to recover tomorrow. The pandemic has added another layer of suffering on top of pre-existing humanitarian needs caused by that mix of conflicts and the intensifying impact of climate change. This year, we saw that really perfect storm of COVID, climate, and conflict continue to impact the world's most vulnerable. So let's take a step back now. Let's look at where we were last December when this report was released on some of these key issues, and let's look at where we are now. So let's go to the next slide, please. So last year, at the time of the GHO launch, we called attention to the issue of food insecurity and the urgent and sustained humanitarian action required to prevent famine in areas that were already on the brink of starvation. Today, we have more than 34 million people worldwide who are still at risk of dying of hunger. Of these people, 11.4 million live in Burkina Faso and Ethiopia, southern Madagascar, Northeast Nigeria, South Sudan, and Yemen, and more than 520,000 people live in famine-like conditions in these countries. Most of those suffering are women and children. Humanitarian organizations need $2 billion to stop famine from taking hold. Let's be clear with ourselves. If we do not act now, lives will be lost and livelihoods will be left in tatters. Let's please go to the next slide. Thanks. The 2021 GHO highlights the impact that COVID-19 and all the associated mobility and travel restrictions have had on displacement, protection, and access. Despite progress in some areas, there are still more than 80 million people displaced by conflict and violence. We have seen large populations in places like the Lake Chad Basin, the Sahel, northern Mozambique, and parts of Yemen that simply cannot be reached as humanitarian agencies do not have safe access. We continue to see violations of international humanitarian law and attacks on civilians and humanitarian and health personnel. Let's please go to the next slide. In 2020, we saw how the protection risks facing IDPs and refugees in normal times were further exacerbated by COVID, most especially for women and girls. We saw that existing gender disparities were heightened and reports of gender-based violence absolutely skyrocketed. I think everybody is well familiar with those statistics. For the first time this year, the GHO requirements has requirements for gender-based violence in all of the humanitarian response plans, but unfortunately, and I think tragically, less than 10% of those requirements has been funded. So this really is an area that requires substantial, additional, urgent investment. Let's please go to the next slide. So, economic situation. At the end of 2020, we examined the impact of the global recession and lockdowns, and that outlook was quite grim. Even though the global economy is less bad off now than we might have expected a year ago, the poorest people in the poorest countries with the lowest vaccine coverage are still bearing the brunt of that perfect storm. The number of COVID cases and deaths in HRP countries is growing. Variants of the virus circulating in almost all HRP countries are more transmissible and in many contexts more deadly. There is actually currently a third wave of COVID-19 threatening the African continent. I'm sure many of you have read about that. I think there's been more than a 20% week-on-week increase now in COVID cases in at least 24 African countries, something we should all be very concerned about. Although we've seen economic recovery begin in HRP countries, it is very fragile and very uneven. Most HRP countries will not return to pre-crises economic levels for years. The World Bank forecasts that globally 163 million people will fall into extreme poverty by the end of this year, including 20 million people in 17 HRP countries. Those already living in poverty will be pushed even deeper, likely adding to the global humanitarian caseload. Sustainable financing for global vaccination, debt relief, and rapid equitable support for international financial institutions in 2021 and beyond will be absolutely critical. Angus, I think this is a point you made in your slides, and I think this is something we all need to come back to. For me, it's one of the most important takeaways, again, from everything we've been observing and all the work we've been doing over the last number of months. Let's please go to the next slide. Thank you. UN coordinated appeals have on average been funded at 60% by end of the year, except in 2020 when the needs were exceptionally high due to the COVID pandemic. This year, we see that coordinated interagency appeals require about $36 billion to assist over 160 million people. That is a 200% increase in people in need compared to 2015. That is absolutely a stunning figure in my view. Next slide. Thank you. So where does that leave us at mid-year? The gap between humanitarian needs and available financing continues to widen. It will not be bridged overnight or even within the next year, despite the very generous quadrupling of donor funding to HRPs over the last decade. And even though donors have provided more than $7 billion of funding this year, we actually still have a very long way to go. Appeals are only funded at 20%. Let me say that again. Appeals are only funded at 20%, and this leaves a gap of more than $29 billion. This is similar in percentage terms to the gap we saw last year at the same time of year, but the fact is concerning, particularly for the 24 plans that are funded under that 20% average. That means that there are substantial numbers of people in need that humanitarian partners simply cannot assist. Please, let's go to the next slide. So there's a cost when funding does not arrive on time. There's a cost when we cannot act. So for example, in Afghanistan, that cost of inaction is quite high. Almost 1/3 of the 40 million people in Afghanistan are now facing emergency or crises levels of food insecurity. Some 700,000 people may not receive monthly food assistance, and more than 3 million children under the age of 5 will face life-threatening health risks. 1 million children are going to miss out on education, and more than 1 million women will be left without safe spaces to receive support. In South Sudan, more than 8 million people need humanitarian assistance. Limited funding this year has already led to cuts in food rations for the internally displaced. Without adequate funding, more than 300,000 children with severe acute malnutrition are at risk of dying. 5.6 million people may not have access to safe water, and 2.8 million children are not going to be able to go to school. And in Yemen, a story that we all know far too well, more than 16 million people face a critical lack of food, including 5 million people who could face death from hunger and malnutrition in the coming months. The aid operation is currently reaching only 10 million people a month. Previously, we had reached 13 million people a month. Despite these grim statistics, there's also some positive news to report, and I want to give a balanced picture. So in Ethiopia, since the start of May, Over 2.3 million people in the Tigray region have been reached with food aid, bringing the total assisted to 4 million. Humanitarians continue to negotiate access to hard-to-reach areas. During the last week, more than 50,000 children under 5 years of age were screened for malnutrition. In Haiti, still one of the most underfunded and forgotten crises in the world, 900,000 people are receiving direct food assistance, up from 250,000 people in 2020. And in Venezuela, the 2021 Humanitarian Response Plan launched last week aims to assist 4.5 million people. Please, let's go to the next slide. So the pool funds are really playing a very critical role. So far in 2021, the OCHA managed pool funds, and here first I'll just talk for a second about the Central Emergency Response Fund, or the CERF, has allocated more than $200 million in rapid response grants in 25 countries for a wide range of needs. CERF also recently allocated $135 million to severely underfunded humanitarian operations in 12 countries with a special focus on disability. And CERF has also supported anticipatory action pilots in Somalia and Ethiopia in recent months. The country-based pool funds also remain an attractive financing tool. In 2021, CBPFs has allocated almost $200 million so far to humanitarian partners, and they've intensified their support to local actors. In 2020, CBPFs allocated over $330 million, a third of all their funding, to local partners. We actually think that's a very important achievement and something we want to try to do more of. Next slide, please. So the type of really quick response and the flexibility and innovation, that we see with pool funds, it really requires predictable and timely support throughout the year. But here you see a couple of trend lines that for me are really of great concern. And what they show you is that contributions to pooled funds are significantly less at this time this year than they were the year before. So I want to bring this to everyone's attention. We really do count on additional support to bring us back up to where we need to be so that we can sustain these important financing mechanisms and the life-sustaining support that they bring to people most in need. And now we'll just go to my last slide, please, which I don't even think doesn't have a nice picture, so apologies for that. But colleagues, I just want to leave you with 3 points as we wrap up the presentation. First, I think it's clear, both from the data that Angus presented and the context that I've now tried to provide, that there really is a very real risk of this grand reversal. It is not a remote possibility. That danger, it's not behind us, and it really needs to be front and center every day as we think about what we're all going to do next. The second point is that funders have been so generous, but funding is needed and more funding is needed, and we need to maintain the momentum and keep building that political support around funding that's timely, that's early, that's anticipatory, that's predictable, and that's flexible. It really does save lives. And as part of securing that funding, we need to ensure that we're using rigorous and transparent approaches to how we define needs and analysis. And it'll be interesting to have a little bit of a conversation around that as well in the Q&A session. And third, I think really most importantly, we need to remember that in the end, this is all about people, right? And it's all about trying to ensure that we reach the people that are really hardest to reach. So we really need to be focused on making sure that our tools and our processes and our procedures, they all really do help us do a better job by those vulnerable people that we really are here trying to serve. So with that, I want to say just thank you for your attention. And we're now going to turn to our panel. As I mentioned at the introduction, we really do have a fantastic panel of very accomplished colleagues who are going to bring us, I think, a really important additional level of insight as we try to unpack some of these really complex issues. So without further ado, I'm really very delighted this morning to give the floor to Matt Kimmel, our panelist from Global Affairs Canada. Matt, please, over to you.
Thank you very much, Lisa. And thank you to you and Angus as well for important and interesting presentations. I think both the reports, the GHA and the GHO, of course, play a really key role in informing our collective humanitarian response. And Canada's been a strong supporter of development initiatives over the years, and the publication of the GHA for precisely that reason. It's an analysis, really helps us identify those areas where we need to do more, both in terms of the amount, where funding is required, but also in terms of how we provide that funding in the most effective way. And of course,
Thanks.
the global, sorry.
No, I was just going to say, no, thanks, Matt. And I failed already in my job as a moderator because I didn't adequately give you the question, which I know you're already prepared to answer. But just for everyone's benefit, you know, Matt, we're really looking forward to hearing from your perspective as a leading humanitarian donor. You know, what challenges have you faced in the last year, and how have you sought to shift and improve how Canada provides assistance? So over to you. Thanks.
Thank you, Lisa. Yeah, and so of course we rely on the GHA. We rely on the GHO as everybody does, as our collective go-to really for the current state of affairs, and for future trends, and to better understand future trends and plan and inform our response accordingly. And this mid-year update today is very useful for us to understand how we as a humanitarian community are really coming together to meet, or at times, of course, failing to meet those unprecedented needs, and how much and how much further we still have to go. And as you've rightly pointed out, and by all accounts, the outlook is not positive. And in fact, you know, we couldn't agree more with Mark Lowcock's points that 2021 really is a year where we are at an important point in time, and we have to really get ourselves back on track and not slip further the other way. The pandemic's really exacerbated what were already alarming trends in humanitarian need. It's made bad crises worse, and it really, as both you, Lisa, and Angus have pointed out, highlighted those intersectional risks of those most vulnerable living in crisis affected states. And of course, 2020 was also the year of continued stagnation in humanitarian funding, both as a trend and also because of the unprecedented domestic fiscal pressures in a lot of donor states. So in that context, of course, we do have to adapt. And I think there are some, I think in some ways, the pandemic has forced us to act a little bit faster. We already knew we had to do things differently. And in some ways, the pandemic has forced our hand a little bit because of its global nature, because of its unprecedented scale, and of course, because of the uncertain operating environment with large-scale border closures and others. What did that mean? What does that mean for a donor, for Canada in particular? I think for us, it was really an opportunity, and there was an urgency to provide more flexible funding. I think the unpredictability of the pandemic meant that we had to provide the majority of our humanitarian allocations to both the UN and the ICRC COVID-19 appeals as fully unearmarked and global level support. I think that was a recognition of that fast evolving and unpredictable situation, and the need to give flexibility to partners on the ground to react as the situation changed. We also argued very strongly that allocations against those appeals should not be made to the detriment of existing humanitarian programming and needs. And so for Canada, what that meant was, we provided upwards of $360 million in new funding, bringing our total to its highest levels of $1.1 billion in fiscal year 2020-2021. And I think that's important because those needs the other needs haven't gone away, of course, and we have to address them. The other thing that we did, I think, early on and was critical was investing in our collective critical infrastructure. So, for example, in the WFP's Common Services and the UN Humanitarian Air Service, which was really key in the context of those border closures, of getting humanitarian personnel to the field quickly, but as well as providing PPE and the means to support those on the front lines. And of course, as the pandemic evolved, so did our focus. We really did shift our focus to secondary impacts of the pandemic. And Lisa, you raised the alarming trends in sexual and gender-based violence. And I think that is one area where Canada was pleased to work with partners like UNHCR really to seek to address those increased vulnerabilities of women and girls. And finally, I think, the pandemic really has brought the localization agenda to the fore. I think we've all had to rely increasingly on local partners who were on the ground, who stayed, and who did deliver and continued to deliver. And I think we really, if there is one key takeaway of the pandemic for donors and for the system as a whole, it really is that need to better support and better empower local partners as directly as possible. So for us, for Canada, that means it means a lot of things. It means in part our continued increase in support to the country-based pool funds. I think the UN CBPFs play a critical role to get the funding to local partners as directly as possible. But there are also other things. There's multi-year funding that has to increase, and we were pleased this year to increase our multi-year funding to 58%, the highest levels, our highest levels yet, and really to working with our partners across the system to make sure that that funding is cascaded down. Question. We have to continue, and those things that we have to adapt into more. Lisa.
Matt, your connection is a little bit interrupted, and I see now you're on mute. So I'm wondering if you can hear us, if you're still connected to us.
Sorry, I don't know if you can hear me now, but I think the connection just dropped at the wrong
You're
moment.
back.
But I'm back.
That's okay. You're back. So anything else from your side, Matt? I think we're having a little bit of a connectivity issue with Matt. Matt, I think you were getting to the end of your remark, were you?
Sorry, I have no idea how long I was speaking to to nobody at all. But yes, I must have been at the tail end. But I was closing on the idea that localization really is the key takeaway and the need to really accelerate our efforts, our collective efforts in that respect. So thank you.
Yeah. No, thanks, Matt. And that's such an important observation, and I liked what you said at the start. You said the pandemic has really forced our hand. So, it's been a horrible crisis. It is a continuing horrible crisis, but are there good things that can come out of this in terms of how we work better? So I think you've raised a number of really important issues there. So thank you for putting those issues on the table. And Matt, thank you for all Canada has continued to do to sustain the efforts, over this last very difficult period. So I'm now very happy to turn to Cecilia Rosselli from NRC. Cecilia, we've heard a donor's perspective on the challenges posed by the current context. As an international NGO, it'd be really helpful, I think, to hear what your lessons were in 2020, what NRC and other international NGOs are doing differently. What are the funding challenges your organization is facing, and what do you think we need to do to better meet humanitarian needs? So, Cecilia, the floor is yours. Thank you for being with us.
Thank you, Lisa, and thank you, Development Initiative, as well, for inviting us to this interesting conversation. The line with Matthew got cut exactly when he was talking about intermediaries, so maybe we can go back to that during the Q&A session. It's something extremely interesting for us. I imagine that I have been asked to talk as well about positive experiences that we had during the COVID-19 crisis, or at least how we have taken some lessons from the very difficult times we all went through. Angus provided a very good analysis of the challenges we are facing, and the report is, as always, extremely interesting to read. I particularly noted down one way of defining the situation as a static picture, because that resonates a lot with me in the sense that we currently see that the system is static, is rigid, and the situation around us is evolving. We see a decrease in funding, in particular from a couple of donors that you have mentioned, Angus, but we don't see new actors. We don't see new energies injected in the system. So I think this is one of the main challenges that we have to address. Talking about the experience and the lessons learned, we knew from the start and since long time that flexibility is one of the key elements that is essential if we want to provide an effective response. Flexibility combined with predictability, I think, is the key for ensuring that we become more efficient and we reach more people with the little funding that we have currently available. We have been long advocating together with Canada and many others within the Grand Bargain for increased flexibility and predictability of funding. And I think we have also provided very good elements of the evidence of the benefits of quality funding, a long list of best practices, some sort of a top menu from which to pick and choose to provide more flexibility into the system. But yet we, in particular a year ago, we were faced with some rigidity from the major donors that we work with. Then when COVID-19 pandemic hit, I think we were overwhelmed by the challenges and by the crisis, and we all came together. And I think rather quickly, we have been able to identify solutions and push for the flexibility that we were dreaming for since few years. So that was becoming a reality, showing that change is possible when there is a common interest and when there is a political will behind it. We have seen some flexibility coming from donors. We have seen, as you were mentioning, Lisa, an increased level of flexibility from the country-based pool funds. So immediately after the pandemic hit, we were able to issue flexibility guidelines that were already in the making in the framework of the platform of the NGO and OCHA dialogue. We saw an historical allocation from SURF to NGOs last year in July that indicated that more innovative ways of working together is possible when we all are coming together. We felt that the best, what worked best actually in the system was the flexibility that was already built in certain partnership that we were already having with a couple of very good donors that we like to call champion. And I'm referring in particular to the program-based approach that we enjoy and experience with Norway and Sweden together with a couple of other NGOs. The program-based approach is a flexible funding approach at programmatic level that allow to intervene in crisis with the right degree of flexibility, with the right degree of predictability, and allow us to reprogram, adjust, move around within the country to be able to respond to the needs when they arise. While with other donors, even during the crisis, we had to go through a multiple series of modification requests with additional paperwork that was definitely not needed at that time. We could enjoy the flexibility provided by the programmatic-based approach that is now piloted by other 2 donors, to my knowledge. So it's definitely a modality that we would encourage going forward. We have been able to collect various examples of what we have been able to achieve together with other NGOs by using this instrument and this tool. So in DRC, in Central African Republic, in Mali, in Libya, in Yemen, and even in crises like the Tigray situation, where we have been able to really relocate immediately funding to be able to respond to the influx of refugees. So that is definitely a tool that we wish to take forward. One thing that I want to highlight, that immediately after the crisis hit, we were all coming together and we were able to unlock some rigidity in the system. Then when time passed by, we slowly went back to some sort of a new normal. And the initial enthusiasm faded away. And we are facing now, again, a stalemate in the discussions around flexibility. We have experienced that in various circumstances, including in the discussion at the Pool Fund Working Group on CBPF flexibility guidelines. So I really think it's important that we remember what we have been able to do together and what we can continue to achieve together. The lack of quality funding is one of the factors that continues to put DRC on top of the list of neglected crises. We have a report that highlighted those, and the most neglected crisis remains in Africa. It's interesting to see that DRC remains among the 5 biggest recipient of funding in the report that Angus just presented. We have to find a way to use the limited resources we have better. And a way to use them better is really to make sure that they reach the ground. They really reach first line responders to be able to act in a timely manner. I don't know, Lisa, if you want me to elaborate a bit further on the issue of intermediaries, I think is an essential point, but I don't know if I have enough time.
Cecilia, you've been making great points. Why don't you give us maybe 30 seconds or so on intermediaries, because I think we'll come back to this in the Q&A, but please just go ahead and give us your highlight points. We wouldn't want to miss them.
Thank you. One thing that I would like to say is that we need funds that is timely, that is flexible, that is predictable, and is also accessible in a simplified manner. And to make this happen, we all have individually as agency, as UN agencies, as donors, try to look individually what we can improve in our own systems to make sure that this is happening. If we are able to do so, we are able to approach partnership with a different mentality, and we might be able to make the system change that is needed to really allow for funding to be cascaded down to first line responders. I think we have to avoid shying away from the real problems. Angus was mentioning the mismatch between the perception between donors giving more quality funding and agencies saying that they receive less. We have to face that. We have to find a solution. The Grand Bargain work stream put forward some recommendations. We have to be able to take action on those recommendations and try to mobilize political will to move forward the agenda for quality funding. Quality funding is instrumental to allow localization and to allow also organizations like mine to receive funds when they are needed.
Cecilia, thank you. Thanks so much for those points. You know, what I take away is preserve these flexibilities, learn and preserve and use them to help make our system a bit less static and a bit less rigid. So super important point for us to take away from today. So I'm really delighted now to be able to go to Dr. Asha Mohammed. Doctor, I saw you, there you are. Great to see you. Thank you so much for being with us. We're so glad to have the Kenya Red Cross Society represented. So we're hoping that you could share some of your observations about what your organization has learned over the course of this year. You know, looking at this issue of increasing needs, but insufficient resources, how that remains sort of the major backdrop to so much of our work. But also particularly from your point of view, looking at the impact all of this has had on women and girls, and how last year's experience is now really informing the way you think about how you're going to mobilize resources going forward. So Dr. Asha, thank you for joining us, and please, over to you.
Thank you very much, Lisa. It's an honor and a pleasure to actually be part of this panel. Very interesting. I would almost have said that I think Cecilia also touched on a lot of things which, interestingly enough, apply for the intermediary, but also apply for those of us who call ourselves the local actors. in terms of funding and the opportunities, and also some of the trends that we've seen. Kenya Red Cross has been in the forefront during the COVID-19 pandemic since last year in March, when the first case was announced in Kenya. And we've worked very closely with the authorities, both at national and county government level, but also with other stakeholders. But our greatest value is actually the work that we do at community level. As a Red Cross Society, we are largely a community-based organization comprising of more than 200,000 volunteers. Majority of those are actually young people, but these volunteers come from the same communities, and they are not, you can say, not imported from one to the other, and therefore very much at the grassroots level. So I think we can pride ourselves in saying that we are where the needs are, and we see them every day, and we know the people behind the statistics that are finally then put on the table. And so 2020 for us was really a very eventful year, I must say, because apart from the COVID-19 pandemic, Kenya experienced still many other disasters. We had floods, we had desert locust invasion, we had conflicts between communities for various reasons, and all this within the context of COVID-19. And so as an organization, it was a difficult time as well to try and reach the different communities that were affected. But again, because of this extensive network of volunteers and being present at community level, it was still very possible for us to work with communities to identify the needs. I think a big thrush was actually also looking at the informal settlements in the urban areas, because again, the challenge we have is that many times we look at the rural communities, but increasingly we see that actually now the urban centers have become actually the disaster risk areas. And so for us, even within the COVID-19 context, we saw this. And so the issue of increasing needs, I think, is very much exacerbated now in the urban centers. COVID-19, I think, was probably the last straw that the informal settlements needed in terms of the economic and social impact that the communities in these particular areas faced. In particular, of course, when we look at the question of women and girls, when we look at the health impact in terms of the infection in Kenya, and it's the same globally, is that more men were infected. But when we look at the impact of this infection and the impact of the lockdown measures that governments put in place, then you can say that, yes, for sure, the statistics are clear. Women and girls were more affected. I can give a few examples. One, when we look at the informal settlement in particular, you find that a majority of the women living in these informal settlements are casual workers. These are people who either work in people's homes to do washing, on a daily basis, and whatever they get for that day is really what they'll put on the, will use to put food on the table. They are the same ones then who will go maybe hawking, selling in the markets, and people would go and fetch and buy their groceries from them. And so we saw many women affected in this sense, but also girls. Because of the lockdown measures, schools were closed for almost 9 months in 2020, in Kenya at least. And when it was time for girls to go back to school, we actually then really saw the impact. So many girls were not able to go back to school, one, because of the issue of teenage pregnancies. So to date, we can honestly and transparently say that many girls will actually not be able to fulfill their dreams unless we are able really to do something to get them back to school. And to illustrate the burden for women as well is to also say, yes, many more men were infected and many more people needed home-based care, but who was going to provide this home-based care? The same woman again. So you can see in terms of the healthcare, in terms of bringing up the children, these were issues that really brought the women in a very difficult situation. Maybe to illustrate this, Lisa, I'll just use a personal experience. I chair a board of one secondary school in one informal settlement here in Nairobi. And when schools reopened, we had quite a number of girls who could not come back because of teenage pregnancy. And we tried to follow their story to try and see what we could do about it. And there was one particular one that really still lingers in my head, in my mind, is that there was a mother who herself is a casual worker who was now struggling to get, jobs to do, and had a daughter who was only in Form 2, that is year 2 of the secondary school, who was now pregnant and actually delivered while the school was opening. And the choice was, so what does she do? Because we were also trying to ask her to let the girl go back to class. But says, okay, so if I let her go to class so that I can take care of her baby, then who is going to go and work and bring us the food and everything else that even this baby needs? And so you can imagine the situation that she finds herself. And what happens next then? Of course, she's also at the risk of mental health issues. And we saw a lot of that, especially with young people as well, because of COVID, because of the unemployment issue, because of issues in the family, sexual and gender-based violence increase, and for sure then women were more affected. But in terms of response, yes, some of us, like Kenya Red Cross Society, tried to reach out to the women that were affected, especially from the economic perspective, through the provision of cash transfers, which allowed them to be able to, first of all, take care of some of the basic needs they had, but also to even start small businesses so that they didn't need then to go too far away to start looking for jobs, and they could take care of the family at that point. But more importantly as well, we had communities coming together, private sector, individuals, also mobilizing food, and we had the honor to be able to distribute this food to ensure that we could balance that also with the containment measures. So clearly that was a big issue, but I think when we look at the question of financing, this is where the challenge was. Yes, maybe there was a lot of resources coming in for COVID-19, but sometimes they were also very much earmarked. There were some donors who were specifically saying, well, we want to support the young people because we know young people are affected. Maybe we want to support the health facilities because we want them to be able to have enough ICU beds, to have enough oxygen and all these kind of issues. But very few, actually, I could probably count them on my fingers in terms of saying we would like to specifically target women. And that for me was really a big gap, and I think a missed opportunity, because we have now a lot of women that are really in a very vulnerable state, and yet yes, maybe we had some resources that could be extended and used actually to support these women. So I think the financing, yes, there was some good support, I will say, maybe not, of course, not enough, but also too much earmarking and not really taking time to understand really who are some of the groups that are really most affected and could make a quick difference in terms of how we recover better, because this is really the challenge. The second issue, Lisa, for me is also the question of the sectors in terms of the funding, because again, it's almost like the funding was moving. It was a moving train. When COVID-19 started, then we were all talking about, yes, funding for sensitization, funding for equipping the hospitals, funding for training healthcare workers. Then now we moved into COVID vaccination. And now most of the donors and partners are moving and supporting vaccination. But we've forgotten that, infections are still happening. Kenya today, we're experiencing our third wave, but very few partners still want to support this very critical part, because vaccination, yes, is good, but how many people will we be able to vaccinate in a short time to be able to give us this herd immunity, which means we still have to reinforce the basic preventive measures. But nobody wants to support that. Everybody now is saying, well, what are you doing on vaccination? We want to support vaccination. So again, this is not helping the situation, and this has been also one of the challenges that we faced. coming back to my question, to my issue about other disasters that were also happening in the country. So everyone was shifting to say, we're just looking at COVID-19. But here we are, we have communities that have been displaced by flooding, moving from their homes where they could keep the spacing, where they probably could wash their hands regularly, now bring them into a camp where the conditions then are perfect for a transmission to happen. But that is not getting the same attention. That is not getting the same support. As we speak, we have communities that we've been supporting since 2019, September, October there, when we had floods again in Kenya, and they are still displaced in those camps today. But we're struggling to get funding to get them out of that particular situation. But we can talk about the COVID-19 prevention measures, but what do you do when you have people in this situation? And even getting just the hand washing facilities could be a challenge. So I would say those are some of the experiences that we've seen and we've struggled with. And so advocating and trying to get a holistic approach to this issue wasn't very easy. There are one or two maybe donors that understood this, and they were funding an integrated approach to the whole problem. But many others would actually come with vertical funding, with earmarked funding, and this was really really challenging for us. Thank you.
Dr. Asha, thank you so much, because our conversations can sometimes be a little theoretical, with the best of intentions, but you've made it very practical. You've really translated this into very real human terms for us. I think in particular the points you made on the importance of sustaining girls' education, and the lifetime impact if a girl doesn't manage to finish secondary school, and just these real life issues that you're practically grappling with every day. I hope we'll all sort of think about that as we leave this session and what we can do to try to make your job a little bit easier. So thank you so much, Dr. Asha. I'm sure we're going to come back to you in the Q&A. So time is not on our side, colleagues, but we have another panelist who I know is going to bring really important insights. Tesfia from the Start Fund. Tesfia, welcome. Lovely to see you on the screen there. So Tesfia, you manage a pooled fund. Given the high needs and the funding constraints last year, could you tell us a little bit about what you think pooled funds achieved that was distinct from what other kinds of funding can achieve? And could you give us a few examples of why speedy and flexible funding, it's really sort of a follow-on from what Dr. Asha was just sharing with us, why speedy and flexible funding is so important for local actors. So Tesfia, welcome, and over to you.
Thanks so much for the invitation to speak on this panel. It's been really fascinating. So in 2020, the START network saw an increase in donor contributions to our pooled funding mechanisms. So we have a few of those. And this is partly owing to the dedicated COVID-19 funding stream that was rapidly set up in response to the pandemic. But of course, we also saw unprecedented demand globally, including from many local NGOs, which are also part of the START network. And depending upon the design of the pooled funding mechanisms, they can offer both donors and responders a number of advantages in the way in which humanitarian financing is delivered. These advantages include efficiency, the potential for more objective decision making, and the potential for more innovations as well. I think one of our panelists has mentioned that too. So first point, efficiency. Pooled funds can offer one coherent entry point for both donors and responders, and this reduces the amount of paperwork required of many different parties. So for local responders in particular, this can really reduce the burden of having multiple application processes and the donor reports associated with the various kind of pots of money. The START Fund has really simple, short, and easy to use templates, and our administrative requirements are really quite light and agile as well. And this we have learned is one of the key things appreciated by responders, particularly local actors, and is also very enabling for the very fast responses that START finances. So the second advantage I'd like to speak to is the potential to be more objective. Depending upon the governance arrangements of the pooled fund, there's the potential for humanitarian financing decisions to be a lot more kind of neutral. So multiple donors contribute funding through a single mechanism, and so the influence of kind of political agenda and media headlines is reduced. At Start Network, we were able to use pooled funding through the Start Fund COVID-19 mechanism to address some of the most neglected and underfunded aspects of the broader crisis, as well as anticipating outbreaks in at-risk geographies and communities which still had lower caseloads at the time, but were at high risk of that changing very rapidly. But at the same time, we continue to fund those crises which were flying very much under the radar due to COVID-19 kind of taking up all the media space. And those were identified by the humanitarian community through our collective kind of what we call the alert raising process. And that process is accessible globally and is very easy to use. The pandemic presented us with a gap in programming where projects were either underfunded or donors were kind of unwilling to adjust existing programs to address those gaps. And START projects specifically targeted the most marginalized communities, such as IDPs, refugees, women and girls at risk of GBV, marginalized communities in overcrowded settings who lack access to services and reliable information and face difficulties in meeting their very basic needs. These groups obviously were not more likely only to be exposed to COVID-19, but were also more likely to be harder hit by the wider impact of the disease, those secondary impacts too. The Start Fund COVID-19 then covered those gaps in national responses and helped member agencies to respond to the crises. We've actually picked up a really important learning from the projects financed through Start Fund COVID-19, which worked closely with local actors. And that was that at a time of increased logistical difficulties due to the restricted access to communities, local actors were able to identify the most vulnerable very, very quickly, very, very comprehensively, which was really important as targeting was so challenging in many contexts due to the sensitivities and the kind of stigma around COVID in various communities. Then finally, the opportunity to be more innovative. So pooled funds have the opportunity to collaborate with a multitude of stakeholders. The local responders that they serve, the donors that support them, all have experience and expertise that can be harnessed and reflected back in the design of the pooled fund. The START network, for example, it's demonstrated what is possible in terms of providing anticipatory funding for humanitarian crises. It's been able to do so because organizations that START serves, they recognize the value of early action, and we have had a number of donors championing this work too and contributing funding towards it. As mentioned in 2020, the START network was able to very quickly set up Start Fund COVID-19 with the support of our stakeholders, and this was modeled on kind of the other pooled funds that we already had. And actually, once one of our donors had contributed funding, it was relatively straightforward for others to come on board too. So I hope that outlined some of those advantages of pooled funds.
Tasvia, that's great, and really congratulations to the role that the START Fund played over the last months. It was so important, and has been so important before, just the kind of example that you all have set that we should all be learning from. So colleagues, we have about 15 minutes left. We do have a few questions in the chat and in the Q&A box rather, and we certainly invite others to add to that, please. But I'm just taking a quick look, and Angus, I see that the first two questions are maybe for you. All right, so I will just quickly read them so that people who for some reason can't see the Q&A box know what they are, and then Angus, maybe we can go to you for a response. So the first one here is from Mark Cohen at Oxfam. Did you look at in-kind assistance, in-kind food aid, for example? in comparison to cash and vouchers? That's the first question. Second question from Ashley McLaughlin is, in DI's presentation, you noted that the transparency of the funding picture is limited because we do not have data on funding beyond primary recipients, particularly UN agencies. What steps are UN agencies taking to provide a fuller picture of the transaction chain from donor to final implementing partner? So Angus, over to you, please.
Lovely, thanks, Lisa. So yes, on the first question, I think this is referring to the kind of cash and voucher analysis that we've done. And obviously kind of the in-kind provision of assistance is can be a critical component of that. I think where we are at the moment is no, we didn't look at that. And the reason for that is that whilst it's recognized that measuring in-kind assistance is obviously critical to kind of widening our understanding of the delivery of support to those in need, what we don't have at the moment is a consensus about how we measure this, unfortunately. So it's a rather uninteresting response, I suppose, but there's a recognition that there needs to be more done so that there is a kind of a common framework that we can use to measure what in-kind assistance is. Obviously, there are some big questions there. Do we measure it at the point of procurement, or do we measure it at the point of delivery? And obviously those things change as we move through those. So we don't, but I think it's somewhere where there needs to be further attention so that we can get to that point where we do agree a level of consensus and are therefore able to kind of measure this clearly. I think then on that second point about transparency and what UN agencies are doing, I'm not sure that I'm necessarily best placed to speak for those UN agencies. I guess what I can say in terms of the broader picture of transparency is that I think broadly what we're not talking about are technical questions. What we're talking about are political questions here, and we're talking about kind of having a consensus and agreement on what the priorities are that we need to know. And then we need to have the commitment that that data is going to be reported. So from a UN agency perspective, that may be opening up their books more so that we can more clearly see what it is that they feel that they're receiving that's flexible funding and why that looks different from what donors are saying is flexible or multi-year funding. And also so that we're able to see how that money is then passed on to subsequent intermediaries and further recipients. That's not to say that there aren't challenges around the internal reporting and accounting within agencies that need to be aligned so that we can measure these things. But I think, fundamentally, the issue around transparency is that it needs to be a continued priority. So within the grand bargain, we know that we can't see how much money is going to local and national actors. We can't see what's being passed on in terms of quality funding. This isn't, these things are things that we could be measuring, but if we're going to measure them, we need to have consensus on what are the fundamental priorities that we need to be able to see. And we need to commit the resources to then being able to report those and have those accessible on public platforms. And I think, so it's a question around its agreement of a consensus rather than just one or two agencies saying that it's important and reporting in this way, one donor reporting in this way. We need to have a consensus, and I think probably a relatively narrow agreed set of things that we report, and then let's all report them properly. And I think that's what we don't have at the moment. And that's where we need to kind of make that change around localization, around quality funding.
No, thank you. Thanks, Angus. So listen, we have about 10 minutes left, and I would like to give each of our panelists an opportunity for a last word, a last reflection here. So I'm going to put a compound question on the table for our panelists, and then they can address it as they might like. So we had a couple of other questions in the chat. Some of them we can try to answer in the chat, but my takeaway of the nature of the questions was, what can we try to do to be more effective with how we use our money? And you've all have addressed that in a particular kind of way. So I wonder if there's just one point you want to come back in a final thought and say, this is, I think, what we need to do more effective. And it kind of aligns with the question I was interested in putting to you, which is, when we gather a year from now at this event next year during the ECOSOC HAS, what really is the most important transformation you want to see on the table? What do you think would really make things fundamentally different? And I think it aligns well with the effectiveness question. So let's maybe go in the same order that we did before, okay? And just we have 10 minutes, so maybe a minute and a half each person to just maybe respond to that little question, and then any sort of final thought that you'd like to share. So Matt, we'll go to you first.
Thank you very much, Lisa. So in closing quickly, I think we can all agree that the needs are growing and the resources aren't growing nearly fast enough to meet them. So there's, inevitably there's two answers there, well, three really. We have to address the needs, but also in terms of resources, we have to broaden that donor base. And I think some of the stuff that we've heard today from the GHA in particular on, encouraging science with private sector engagement. I think we have to continue to encourage that, but also, as Lisa, you pointed out, we really do have to work collaboratively along the humanitarian development and peace nexus and really leverage the value added of development actors and MDBs in particular that really have the tools to address some of the systemic issues, some of the resiliency issues, and really help us fill that void. But then we also have to do better with the money that the funding that we are providing. We do have to provide more quality funding, and I think with NRC, with OCHA, as co-conveners of quality funding workstream of the Grand Bargain, I think we've done a good job of identifying some of those key things that we can do together. We touched on quite a few of them, on earmarked, loosely earmarked funding, but also on multi-year. Cecilia raised programmatic approaches that we are piloting with NGOs as well. I think provide a really different way of giving partners that flexibility, and drawdown funds, right? We've put in place new drawdown arrangements with a wide variety of partners, including the ICRC and the IFRC, and those really allow for quick, rapid responses, and the CBPFs. And the SURF, really the pooled funding mechanisms more broadly. But I think what all of this shows, and what we've really learned through the Grand Bargain, and which has come up now in the Q&A, is that quality funding isn't simply about donors. It really is a shared commitment from the whole system. And I think we've heard questions about reporting. And that cascading of quality funding. And I think, we want to continue that discussion and really bring us all together and finding a way to advance quality funding together. I think it goes beyond the donors, and that is something that the Grand Bargain has identified, I think, quite well, the need to really address quality funding from a holistic perspective, one that cuts across all of the priorities and brings us all together in that regard. So looking forward to this discussion next year. Hopefully we've made progress within the Grand Bargain and amongst ourselves individually. Thank you very much, Lisa, and thank you to all the other panelists for some very, very insightful conversation.
Thanks, Matt. There really is a virtual cycle we all need to be conscious of here. Cecilia, over to you.
Thank you. I actually have many things I would like to say, but I will focus on 3. So the first one is that it is a pleasure to see OCHA and START network talking about pool funds. I'm a fan of pool funds. I think it's one of the key instruments we have in our toolbox to enhance the system. So really pleased to see that. So one wish next year, this time, would be nice to see that the SURF has made another allocation to NGOs. And we can learn from the experience last year and see how we can improve. Second, I would like to link to the point made by Angus about the need to move from technical discussions, we had many already, to the political level. Yes, I agree. We already know what needs to be discussed. We have an opportunity with the new Grand Bargain 2.0, the new leadership. So let's use it. Let's stay focused on few areas that we want to improve. And then going back to the intermediary element that we discussed earlier, I would like to bring one example. Education Cannot Wait, as a donor, is providing multi-year grants to their first direct grantees, which is fantastic. And they are also quite flexible, I would say. But then intermediaries can apply for projects only up to 9 months. So where is the predictability? Where we lose completely the benefits of a multi-year plan and the capacity to really have a proper plan to address needs in a multi-year fashion. And then the third point that I would like to make in my wish list actually is to see more donors joining the programmatic based approach and have an opportunity to have donors sitting together and learn from each other from the different pilot and more advanced experiences that some of them are having. And we are happy to contribute to that. And I sincerely hope that there will be one of the famous Caucasus, in the Grand Bargain to discuss this. Thank you.
Thanks very much, Cecilia. Dr. Asha, please.
Yes, thank you, Lisa. I think a lot of what I would have wanted to say has been said, so I'll be very brief. Clearly, yes, I would really hope that we can see more funding going directly to local actors, because I think the benefits for that have been explained. But for me, one element that's been missing maybe in this discussion that I would like to raise is really the question of capacity building, strengthening the capacities of local actors. And I think that's the only way that even for the donors, the comfort of saying that, yes, the funding can go directly to local actors and it will be used effectively, and the whole question of accountability and everything else. I think there isn't enough attention and support to the building of capacity of local actors, because we've seen it even with COVID-19 that yes, many times there was a lot of that bureaucracy in trying to say, oh, okay, maybe we need to, even wanting to do due diligence in the middle of a COVID-19 pandemic of an organization. I think that will not get us where we really want to go. So I think that deserves some attention. And with that, I believe it will be possible. Because again, with COVID-19, we've seen that sometimes even for our international partners, then they are not able to come on the ground, and it's only the local actors who can do it. So why not prepare them and give them the capacity to be able to do that when we need to do it exactly. Thank you.
Thanks, Dr. Asha. Really an important practical suggestion that I'm sure everybody has heard loud and clear. So thank you for putting it on the table. Tesfia.
Thank you. So one of the biggest systemic problems that the humanitarian sector faces is slow and reactive funding. For every $10 spent on humanitarian relief, only $1 is spent on reducing and managing risks. You know, despite the improvements in the abilities to predict the likelihood of disasters, the humanitarian system continues to react as though disasters are unexpected surprises, responding only after they occur, and then often very slowly. So the transformation we'd like to see, and that START Network advocates for, is to urgently manage risks more proactively and respond faster when crises happen. I'd like to see more decision-making decentralized to the local level. So local actors are already there. They don't have to fly in, so responses can be so much faster. They also have the in-depth knowledge of the context and are able to respond in more contextually appropriate ways. Thank you.
Thanks, Tesfia. Yeah, a statistic that I have heard recently is 20% of our crises are highly predictable, but only 1% of our funding is highly predictable. So that's a ratio I think we all need to go back and think about a little bit. So we have 2 minutes left. I want to give the floor back to my co-host, Angus. Angus, anything you'd like to say in closing, please?
I'll be super quick. I will second Matt's comments, I think, on the importance of the kind of wider coherence with development actors. And I think as part of that, I would say, given where we started, given where we know crises are taking place, where extreme poverty is growing, that we need to ensure that this bigger pool of development funding is primarily targeted on poverty reduction and reaching those furthest behind, because that's fundamental to getting out of this situation of crisis. And then coming back to my points on transparency, I would say also this isn't just about transparency for us sitting in headquarters. This is also about transparency and visibility for local and national actors. And those conversations need to be happening collectively. So we need to be making sure that we're able to see, and local and national actors have the data that they need, not just those of us sitting in headquarters.
Angus, thank you. And let me just say a huge thank you to the panelists for sharing all their insights and expertise and advice today. Angus, thank you so much to you and the team at Development Initiatives for all the thought content you've put on the table to help us think more sharply and more proactively about what we need to do in the future. And really huge thanks to everybody who's participated today. We are so grateful for your interest and your commitment to these issues. I'm already thinking ahead to the event next year and the kind of conversation that we want to have. So I'll close here just by wishing everyone a very good rest of the day, and again, appreciate you being here with us. Thanks everybody very much. Goodbye.